No hospitals, no antibiotics, no pharmacy down the street. For most of human history, getting sick wasn't a minor inconvenience. It was one of the most dangerous things that could happen to you. So what did ancient humans actually do when illness struck? The answer involves plants that actually worked, rituals that make surprising psychological sense, and yes, at least one practice that involved drilling a hole straight into someone's skull while they were still alive. By the end of this video, you'll never complain about a waiting room again. Let's start with the obvious question. Without modern medicine, how did anyone survive getting sick at all? The truth is, a huge number of people didn't. For most of human history, life expectancy was brutally short, partly because infections that we treat with a 5-day course of antibiotics today could easily kill a healthy adult. A small cut could turn fatal. A common cold could spiral into pneumonia with no way to stop it. Illness wasn't just uncomfortable. It was a constant, looming threat, and entire cultures organized themselves around trying to survive it. So the first thing ancient humans did was observe. Long before anyone understood bacteria or viruses, people were sharp observers of cause and effect. They noticed that certain plants seemed to reduce pain. They noticed that certain foods upset the stomach and others soothed it. They noticed that wounds cleaned a certain way healed better than wounds left alone. This trial and error knowledge, built up over countless generations, became the earliest form of medicine, passed down orally, tribe to tribe, healer to apprentice, long before anything was written down. And here's something that surprises people. A lot of this early plant-based medicine actually worked, and modern science has since confirmed why. Willow bark, chewed or brewed into a tea by multiple ancient cultures, contains a compound called salicin, which your body converts into something remarkably close to aspirin. Ancient Egyptians, Sumerians, and later the Greeks all independently discovered its pain-relieving properties, thousands of years before anyone understood the chemistry behind it. They didn't know why it worked. They just knew it did, and that was enough to make it a staple of ancient medicine cabinets across multiple continents. Honey is another example. Ancient Egyptian medical texts, some over 3,500 years old, describe applying honey directly to wounds. At the time, this probably looked like superstition. Today, we know honey has natural antibacterial properties, low moisture content that inhibits bacterial growth, and a mildly acidic pH that actively helps prevent infection. Modern medicine even uses medical-grade honey in some wound treatments today. Ancient healers stumbled onto something real, purely through careful observation, generations before germ theory existed. Now let's talk about who actually treated the sick, because it wasn't one single figure, it was often several overlapping roles depending on the culture and time period. In many hunter-gatherer and early tribal societies, the shaman or medicine person held a dual role, part healer, part spiritual guide. Illness wasn't always seen as a purely physical problem. Many ancient cultures believed sickness could be caused by evil spirits, angered ancestors, or a broken spiritual balance within the person or the community. So treatment often blended the physical and the spiritual together, herbal remedies alongside chants, rituals, and ceremonies meant to restore balance. This might sound purely superstitious from a modern lens, but there's a psychological layer here that's genuinely worth taking seriously. Ritual, chanting, communal attention, and a trusted healer's confident presence can measurably reduce stress and pain perception, something modern medicine now recognizes as part of the placebo effect and the broader mind-body connection in healing. Ancient healers may not have understood the mechanism, but the practice of surrounding a sick person with focused care and ritual likely did provide real, measurable comfort, even without modern pharmacology behind it. As societies grew more complex, so did their medical systems. In ancient Egypt, physicians were often highly specialized. Some ancient texts describe doctors dedicated entirely to eyes or entirely to teeth, remarkably similar to how we specialize medicine today. Egyptian medical papyri describe detailed diagnostic processes, examining a patient, noting symptoms, and prescribing specific treatments, an approach that was genuinely systematic for its time. They used splints for broken bones, sutures for wounds, and a surprisingly wide pharmacy of plant, mineral, and animal-based remedies. In ancient Mesopotamia, medical practice split into two recognized types of healers: One was the ASU, which functioned closer to what we'd call a physical doctor, treating symptoms with herbal remedies and practical techniques. The other was the Ashipu, a more spiritually focused healer who dealt with what were believed to be supernatural causes of illness, through rituals and incantations. Interestingly, historical records suggest people often consulted both, treating the physical and spiritual dimensions of illness as complementary, not competing approaches. In ancient Greece, we start to see one of the biggest turning points in medical history. Hippocrates, often called the father of Western medicine, pushed the radical idea that illness came from natural, physical causes, not divine punishment or angry gods. This was a genuinely revolutionary shift in thinking for the time. Greek medicine developed the theory of the four humors: blood, phlegm, black bile, and yellow bile, believing that illness resulted from these falling out of balance. We now know the actual science behind humor theory was wrong, but the underlying instinct that the body operates on internal systems that can become imbalanced, and that illness has natural, observable causes laid important groundwork for medical thinking for centuries afterward. Now here's the part one promised at the start: trepanation, and it's exactly as intense as it sounds. Trepanation involved drilling, cutting, or scraping a hole directly into a living person's skull, and archaeologists have found evidence of it across cultures on nearly every continent, dating back thousands of years, in some cases over 7,000 years. And here's the detail that genuinely stuns most historians. Bone regrowth around many of these skull openings proves that a significant number of patients actually survived the procedure, sometimes for years afterward. So why would ancient people do this? Theories vary. Some researchers believe it was used to treat head injuries or relieve pressure from skull fractures, which honestly lines up reasonably well with basic anatomical logic. Others believe it was performed for spiritual reasons, to release evil spirits believed to be trapped inside the skull, causing seizures, headaches, or mental illness. It's entirely possible both explanations are true depending on the culture and time period. Either way, it represents something remarkable. Ancient humans were willing to perform genuinely invasive surgery, with stone tools, no anesthesia beyond whatever herbal sedatives were available, and no understanding of infection risk as we know it today, and some patients lived through it. Beyond surgery, everyday illness prevention also existed in forms we'd recognize today. Many ancient cultures understood, at least intuitively, some basic principles of hygiene and contagion, even without understanding germs. Ancient Jewish law included detailed guidelines around quarantine for certain skin conditions. Roman society built extensive public sanitation systems, aqueducts, sewers, public baths, partly for comfort, but also because they'd observed a connection between cleanliness and health, even without the microbiology to explain why. Diet was treated as medicine too, long before food as medicine became a modern wellness phrase. Ancient Chinese medicine, developing over thousands of years, built an entire system around balancing specific foods, herbs, and the body's internal energy, or qi, to prevent and treat illness. Traditional Ayurvedic medicine in ancient India developed alongside this, focusing on balancing bodily constitutions through diet, herbs, and lifestyle practices, some of which are still actively used and studied today. Childbirth deserves its own mention here too, because it was one of the most dangerous events a person could go through in the ancient world. Midwives held deeply respected, specialized roles across nearly every ancient culture, developing real, practical knowledge about pregnancy, labor positions, and herbal aids to ease pain or manage complications. Maternal and infant mortality rates were extremely high by modern standards, a sobering reminder of just how dangerous everyday life once was, even for something as fundamentally human as being born. So when we zoom out and look at the full picture, ancient medicine wasn't as primitive or clueless as popular imagination often assumes. It was layered, and it was surprisingly systematic in its own context. It blended real, empirically discovered plant remedies with spiritual belief systems, careful clinical observation with ritual and community support, and in some documented cases, remarkably bold surgical intervention. Ancient healers were working entirely without germ theory, without anesthesia as we know it, and without any understanding of viruses or bacteria, and yet, through pure accumulated observation across countless generations, they built medical systems that, in places, weren't nearly as far off from real science as we tend to assume. And honestly, some of what they figured out, willow bark, honey on wounds, the basic idea that community and ritual support genuine healing, we're still using pieces of it today, just with better tools and a far deeper understanding of why it actually works. If you want to see what ancient humans really ate on a normal day, I've got a full video on that right there. And if this gave you a whole new appreciation for modern medicine, hit subscribe, because next time we're asking something even stranger. What did ancient humans do when someone in the tribe actually died?